Hi friends, let's talk about fibroids today. Most of you must have heard about fibroids. You people must have seen reports with fibroids. It is a tumor in the uterus. But the good news is it is not cancer. Fibroids are not cancerous. Fibroids are benign tumors in the uterus. Now you may ask me, what is this benign? Benign means it is not cancerous. It will not harm to some extent. What are the symptoms of fibroids? Fibroids may have pain. Women with fibroids can have heavy menstrual flow, or it can cause infertility. There are patients who have fibroids and are pregnant also. That means all fibroids will not cause infertility. Some fibroids which are subserous. When I say subserous, it is fibroids which is sitting on top of the uterus. When I say intramural, it is in the myometrium, that is wall of the uterus, and submucous, that is when it is in the cavity. When fibroids are inside the cavity, that is inside the uterus, that can cause symptoms of heavy menstrual flow, and also it can cause infertility. Intramural fibroids, that is fibroids which are in the muscular layer of the uterus, sometimes can cause infertility and sometimes can cause pain or heavy menstrual flow. But subserous fibroids will not cause any problems, even if they are to a big size, if they can grow to any size and they may not be symptomatic. But some fibroids can cause pressure symptoms of bowel and bladder, and also it can press upon the ureter, that is the tubes which carry urine to the bladder. Now what to do with these fibroids? When fibroids are there, don't get scared. If it is a small fibroid, 1 to 2 centimeters or even 3 to 4 centimeters, subserous fibroids, that may not cause any problems. Just get a follow-up every year and you remain asymptomatic. But if there are fibroids which are big, more than 5 to 6 centimeters, then we have to remove it laparoscopically. There are different methods of tackling fibroids. There can be tablets, there is HIFU, then there's a uterine artery embolization. But nothing works for fibroids. What works is removal, that is through laparoscopy. Laparoscopic myomectomy is a time-tested treatment for fibroids. So if you have a fibroid, please meet your doctor. If it is small fibroids, don't worry. And if it is about 6-7 centimeters, again I would advise you not to undergo hysterectomy if you are below 45 years. Get the fibroid removed and save your uterus. The moment you remove the fibroid, all your symptoms will go. And if there are infertile patients, the moment we remove the fibroid, if a woman is not conceiving for 5 to 6 years and the cause is fibroids, the moment we remove the fibroids, the lady will conceive, unless and until there are no other problems of infertility. So whenever there is a fibroid, do not get scared, do not get worried. No other kind of medicines will work. Ideal would be laparoscopic myomectomy, and if it is, of course, if you are already 50 years and if it is 6 or 7 centimeters, then maybe you will have to undergo a hysterectomy. But below 45 years for fibroid, please do not undergo a hysterectomy. And if you find I have a fibroid and you are having problems in conception, please get your fibroid removed so that you can conceive without problems.